Welcome to Module 1, Session 3, on the role of the health sector and health professionals in addressing female genital mutilation and accountability. The objectives of this session are to understand why the health sector should actively address FGM and to understand the different roles that health workers can play in both preventing FGM and providing the highest quality care to treat the complications. This session will be structured as follows. First, we'll talk about why the health sector needs to play a role in addressing FGM. Then, we'll talk about how the health sector can contribute in FGM abandonment efforts and how health workers in particular can contribute to ending FGM. We have identified several gaps in the health sector response to FGM. These include, in many countries, lack of protocols, manuals, and guidelines for the prevention and care of FGM, insufficient training and support for healthcare providers. There's limited governance, finance, and political will for the health sector to engage adequately on FGM prevention and care. There are lack of laws and regulations in many settings, and often health systems are strained with other priorities and may not be able to adequately respond as a result. So why does the health sector need to be involved in efforts to end FGM? First, we saw that FGM is a public health issue affecting over 200 million women and girls today. FGM is costly to the health sector. Treatment of the health complications of FGM is estimated to cost $1.4 billion per year. FGM medicalization trends are increasing. More healthcare providers themselves are actually performing FGM, and this is a worrisome trend. We also know that healthcare providers can be influential and powerful opinion leaders. They're well respected in their communities, and they can be involved in changing attitudes towards FGM. We have evidence on this, and we also have some resources and tools to help guide these sorts of trainings and approaches. The health system plays a unique role in multi-sectoral efforts. It can offer a wide network of services. It reaches far into many communities at the primary healthcare level in particular. The health systems have a mandate to provide both preventive and health promotive care, as well as curative services. We also see that there are intersectoral linkages with other sectors, and there are opportunities there of linking with the legal sector, the education sector, that are already involved in these efforts. The health sector has not always been actively involved in abandonment efforts, but it does have an important role to play. So how can the health sector contribute? And who from the health sector should be involved? This, of course, includes the Ministry of Health, as well as professional associations, whether those are associations of nurses, midwives, and doctors. It can include health workers themselves who are working at the facility or the community level, and it includes health service users. How can they contribute? Well, they can develop health sector plans on FGM, which take into consideration the different contextual factors and the resources and the health sector players in the particular setting. The health sector can advocate for funding and for legal enforcement of FGM laws. The health sector can also provide services both for the care of women and girls who have already undergone FGM, as well as preventive services. And healthcare providers can be champions for change. When WHO has worked with different countries to develop health sector plans on FGM, we've structured these around 4 pillars of activities. These include the strengthening of governance and political will, improving the training of healthcare providers and building their capacity, enacting regulatory and accountability mechanisms for professional codes of conduct, and monitoring and evaluation of programs and actions to document their impact within the health sector and beyond. So why is it important that healthcare providers are engaged in efforts to end FGM? Well, they are the first point of care at primary care level in providing services to women and girls who have already undergone the practice or who are at risk of the practice. They can serve as a bridge between the healthcare facility and the community. As members of the health system, they receive training and information and resources from the health system, but they also understand the social norms that underlie the practice of FGM. Healthcare providers have knowledge and skills. They're highly valued by the patients and clients who seek services. They're respected and listened to by individuals and families. They also have a unique position in bringing about change. Healthcare providers can play many roles. They not only provide care, but they can also be effective advocates for change and ending FGM. In their direct interactions with clients and communities, their opinions and advice are well respected. They also have interaction with their peers and can influence their peers. They're also educators of the next generation of healthcare providers. They're representatives of the healthcare system, and in general, they can be important advocates for change. To conclude this session, I invite you to watch the short video, which is linked at the bottom of the slide. It's the story of Leah, who's a midwife who decides to plant a seed of hope to end FGM,